ويسرنا نلتقي عبر الفيس تايم مع الدكتور ارجيت من جمهورية الهند الصديقة وأحد الأطباء العاملين في الصفوف الامامية. First of all, Doctor, welcome to our show. Good evening, Kuwait.
Good evening, dear viewers. It's my pleasure to be here with you today.
The pleasure is us, Doctor. Before we start our show, on behalf of myself, Doctor, and the working crew, we are very appreciate and gratitude your efforts and everyone who's working in the first line.
Thank you very much.
You're most welcome. Doctor, tell me about the curing methods for the disease.
Yeah, it's now more than 3 months we are encountering this pandemic of coronavirus disease in Kuwait. And we are now quite familiar with the natural course of the disease and its manifestations. We are largely seeing two different types of presentations. In the large majority of the patients, what we find is that they behave like something like prolonged viral flu. And this category of the patients, they just come with fever, some cough, body ache, myalgia, headache, and this lasts for a couple of days, like 7 to 10 days or so. This type of patients are not admitted and they are advised for home quarantine till they recover. And most of them, they receive symptomatic treatment, for example, paracetamol to relieve their fever and body pain. And also we do give some supportive treatment like vitamin C, vitamin D, zinc, and most frequently they also receive some oral antibiotics. But some subtype of patients, approximately like 20-25%, they have prolonged fever, high-grade fever, and also they develop chest infection like pneumonia. And this category of patient need hospitalization and more close observation. We need to give them IV antibiotics, and also we need to assess their clinical status in a very close manner by laboratory monitoring, and they require other medications like blood thinning agent like Clexane, and in some serious condition we do give medicines like Actimra, which is a biological medicine. And for the last couple of weeks the Ministry of Health has allowed the use of plasma therapy, which is reserved for serious patients, those who do not respond in spite of antibiotics and other supportive medicines.
Thank you so much, Doctor, for sharing this information for everyone who's watching us through the KTV1, the main channel. أنا سألت الدكتور ارجيت عن طرق علاج المرض، وأجاب هنالك شريحتان. الشريحة اللي تعتبر الأغلب هم الحالات العادية، فهم يبقون في المنزل مع تلقي العلاج الخاص للشفاء من الفيروس. وأيضا لدينا الشريحة الأخرى وهم الأقل نسبة، هم الحالات الحرجة، فهؤلاء يستدعى دخولهم إلى المستشفى، وأيضا الذين يعانون من أمراض أخرى كالقلب تزامنا مع إصابتهم للفيروس. Doctor, it goes me to another question. When does the patient require ICU support?
Yeah, approximately 5% patients, unfortunately, they deteriorate in spite of initial treatment and IV antibiotics. And this is monitored with the help of their assessment. And if the patient develops rapid hypoxia, and we can do certain laboratory testing. For example, we measure their C-reactive protein, we measure D-dimer, and we also measure ferritin. And on the basis of this assessment, if the patient deteriorates in spite of supportive treatment, like the patient requires more than 10 liters of oxygen per minute and still not able to maintain their saturation, this means that this subgroup of patients are suffering from severe respiratory distress due to pneumonia related with COVID-19 virus. So we consult the ICU specialist, and this type of patient, they need more intense monitoring and ICU treatment.
اوكي دكتور. affirmative answer you share with the viewers now. انا سالت الدكتور عن متى يحتاج المريض الى دعم وحده العنايه المركزه، والاجابه باختصار هو الذي قاله هم حالات قليله جدا، وهم تعتبر نسبه 5%، حالاتهم جدا حرجه ولم يتشافوا ابدا من مرض الكورونا. دكتور, it goes me to another question. What are the procedures to prevent the spread of the disease?
Yeah, this is probably one of the most important aspects of the disease control and prevention. We all know that prevention is always better than cure. We have to ensure at a social and community level the guidelines which are instructed by the Ministry of Health, like physical distancing, at least keeping a distance between 2 meters between the two individuals. In addition, somebody when coming out from home should wear the mask which should cover the nose and mouth, wear the gloves, use sanitizer if they are coming in touch of touching any surface, and frequent hand washing, at least lasting for 20 seconds or more. The reason of all these precautions is that many patients in the early part of their disease, they may not be symptomatic, particularly when they are in the incubation period. And in that time, they may spread the disease without throwing up any symptoms of the disease.
اوكي دكتور. انا سالت الدكتور عن ما هي الاجراءات الوقائيه او التي تحد من انتشار مرض الكورونا، واجاب وهي التباعد الاجتماعي وعدم الخروج من المنزل الا للضروره، واذا خرجتوا من المنزل احرصوا على لبس القفازات وارتداء الكمامات وتعقيم اليدين، بالاضافه ايضا الى حرصه، ووجه هذه الرساله مره اخرى عن اهميه التباعد الاجتماعي. دكتور, let's focus more about what do you think, because you're working in the Ministry of Health field and the Ministry of Health sector. What do you think about the healthcare?
Yeah, I am immensely thankful to the Ministry of Health, Government of Kuwait. They have made meticulous and elaborate arrangements to contain this pandemic. We have tertiary hospitals. In every tertiary hospitals, there are dedicated corona wards has been selected for patients. In addition, we all know that we have Jabbar Hospital, which is dealing with solely with the coronavirus patients. In addition, there are field hospitals which has been made in Meshrif Hospital, and also there are institutional quarantine for taking care of the minimal symptomatic patients who needs isolation. Apart from this, in terms of the manpower setting, now all the people working in the disease, they are in the front line, like the doctors, the nurses, technicians, laboratory workers, the support staffs. All of us are joining hand in hand to work together to ensure the patient safety, recovery, and reduce mortality. I would like to mention here even the grassroots worker, for example, the poor Bangladeshi porters or cleaners, laundry workers, CSSD staffs, they are also working like cleaning the wards, disposing the waste materials. This also takes a long way to help the patient's rapid recovery and also help altogether to contain this epidemic.
Okay, Doctor, and also we appreciate your efforts and everyone who's working in the Ministry of Health sector. أنا سألت الدكتور عن رأيه في الرعاية الصحية في دولة الكويت، وأجاب أنه أثنى وشكر جهود وزارة الصحة للتصدي لفيروس كورونا، وقال أن كل العاملين في وزارة الصحة بمختلف تخصصاتهم وعملهم يعملون على قدم وساق للحد من انتشار الفيروس. Doctor, let's go to another topic now. How do you see the 5 phases till we go back to normal life?
Yeah, this 5 phase of transition is actually how to gradually lift this lockdown and then going back to a phase of normalcy. If you closely observe this phase of transition, it has been carefully selected in order to ensure that gradually the disease stops spreading in the community so that the normal activities in all the field and all sectors, both in government and private, can come back to a normal status. The Ministry of Health has selected different zones depending on the number of cases which are reported from various areas, and the lockdown which is currently in place, for example, complete lockdown or partial lockdown, these are all to ensure to prevent community spread and eventually reduce the number of patients who are affected by this disease.
اوكي دكتور، انا سالت الدكتور عن كيف ترى المراحل الخمسه حتى العوده الى الحياه الطبيعيه، واجاب انه شيء مهم واختير بعنايه لزياده حالات الشفاء والحد من عدد الاصابات. Doctor, because you are already sharing with the viewers about the 5 phases and your opinion about it, can you highlight the phase 1?
Yeah, we all know that the phase 1 has been implemented from 31st of May, and currently we are approximately 10-12 days after the transition phase 1. We do find now that number of cases are showing there is a downward trend, and we know that right now places like Jalib, Hawali, Farwania, Mahabula is on complete lockdown, and also rest of the country is also having partial lockdown between 6 p.m. to 6 a.m. All these measures hopefully are likely to take its effect to ensure that we do see less number of cases in the days to come.
Okay, Doctor, now is the time for our important question. Can you send to the viewers a message in your own language, but in short term, okay?
Yeah. मैं पहले हिंदी में बोल रहा हूँ। कुवैत में स्थित सारे भारतीय भाषाभाषी के लिए मेरा विनीत निवेदन है कि आप सब लोग गवर्नमेंट ऑफ कुवैत का नियमादेश सारे पालन कीजिए। हम सबको एकजुट होके इस महामारी का मुकाबला करना पड़ेगा। কুয়েতে অবস্থিত বাঙালি ভাষাভাষী সকলের কাছে আমার একান্ত অনুরোধ যে আপনারা কুয়েত সরকার এবং স্বাস্থ্য মন্ত্রণালয়ের সকল আদেশগুলি পালন করে চলুন। এই করোনা মহামারীকে আমাদের সকলকে একজোট হয়ে মোকাবিলা করতে হবে। Thank you.
Thank you so much for being with us today, Doctor. Thank you very much. كان معنا الدكتور ارجيت من جمهورية الهند الصديقة وأحد الأطباء العاملين في الصفوف الأمامية.